This is America, home of the brave and land of the free. And yet, we are often only as free as our circumstances dictate.
Everybody really is impacted by what we call social determinants of health. And those are a variety of factors that are in our environment, where we live, where we play, where we age, that impact our health and quality of life outcomes. And so those are things like transportation, access to healthy food.
Northwestern has been responding to community health needs since we became a hospital. We really are interested in not just treating the patient, but treating the community from which that patient comes from. We understand that 80% of one's health really is impacted outside the four walls of Northwestern medicine.
Hi, Ana Paula. How are you?
How are you?
Pretty good, thank you.
Core to our mission as a healthcare provider is ensuring that we have access to care for individuals across Chicagoland. We're actually bringing providers directly into the community. So Old Irving Park is an example of a location that just opened this past year, and Bronzeville is an example of a location that will be opening in the next year and a half. We also have things like the African American Transplant Program, the Gay and Bisexual Men's Program, or the Hispanic Transplant Program. They are geared to specific populations, many of them traditionally under-resourced communities. And then we have 11 clinical community partnerships across the health system. So those are federally qualified health centers or free clinics. Engaging with community-based organizations and individuals is essential for what we're trying to do in helping build stronger communities. We have over 200 community partners across every part of our health system. And community-based organizations are so important to us because they are in the community. They understand the issues that the community members are facing.
We were one of the first hospital organizations to select violence as a priority health need. Why does Northwestern Medicine care about violence? Well, we care about violence because we care about our community. The cycle, you can say, it begins when a patient comes into our ED. We call our 24-hour, 7 days a week violence responder activists. And we have activists come to the emergency room and try to work with the patient and try to work with the family to hopefully interrupt the cycle of violence. So I want to specify the work that we do is community-led. The community tells us how we can participate, how we can help support.
So another way that we help build stronger communities is by being more purposeful about engaging with diverse suppliers from under-resourced communities. Our construction team, for example, last year spent $45 million with diverse suppliers. Team NM is our employee volunteerism group. Last year, almost 4,000 of our employees participated in over 450 service events. We know that having a strong, stable job is an important indicator of health, so we're committed to economic and workforce development as a way to help build stronger communities.
Our tattoo removal pilot, it is a new program that started in mid-January in Northwestern Medicine. Tattoo removal helps out patients that are not able to obtain a job because of the tattoo, so there's also a new beginning for them.
My name is Orlando. I'm here at Northwestern Medicine to remove a mistake I made 24 years ago.
It allows them to really make that clean break from their previous life.
To be a big change in my life, so I'm very excited about that. New job opportunities, good example for my daughter.
We want when our patients to arrive to make sure that they see themselves reflected in the people that they interact with. We started a community hiring program. We've seen a significant amount of increase in hiring from under-resourced communities.
Northwestern is doing this because it's a priority for them. We do it because we know it's the right thing to do.
We need to wrap our arms around that patient and around the family members while they begin that journey towards healing.
That's what's made Northwestern so unique, because they've always had some skin in the game.
It's a new chapter, and I'm just very excited about this.
Northwestern Medicine is committed to making sure health, stability, and opportunity are accessible in all communities, because these simple freedoms can make any life fundamentally better.